Knock, knock. Can I come in?
Yes, come in.
Hi, my name is Collin Abe, and I'm going to be your student nurse today. Could I get your first and last name and your date of birth?
First name is Minha Kim. Last name is Kim. Date of birth is 10/12/99.
And your first name is Minha?
Yeah.
And I'm just going to go ahead and check on your wristband. Okay, perfect. That confirms it. And do you have any allergies?
No allergies.
No allergies? Okay, and I confirm my trade that says no allergies. I'm going to go ahead and put on some gloves. How we do this? First of all, what brings you with me today?
I have pain in my left.
Pain in your left ankle, and is it only in that right ankle or left ankle?
Yeah.
Sorry. Is that left ankle? Left ankle? Okay, and sorry, give me 1 second. And what does it feel like exactly? Is it throbbing? Is it sharp?
It's throbbing.
Throbbing pain? Okay. And does the pain radiate anywhere? Does it kind of stay there?
Just stay there.
Stays there? Okay. And if you had to rate this pain on a scale of 0 to 10, 0 being no pain at all, 10 being the worst pain you can imagine, what would you rate it?
It's about a 6.
A 6? Okay. Is that tolerable for you, or would you like it to be lower?
I would like it to be at a 2.
About a 2? Okay, got it. And does anything make it better or worse?
I usually ice it.
Ice it? Okay. How about any like movement? Does it get better or worse with movement?
It hurts with me.
Hurts with movement? Okay. And then when did this happen again?
Like
2 days ago. Has it gone any better or worse since then?
it's about the same.
About the same. Okay, so we're gonna see what we can do to assess that. So we're gonna get started with our head to toe assessment. It's gonna be about 15 minutes. I'm gonna be assessing body systems from your head down to your toes. If you have any pain regarding that ankle or any concerns, please feel free to let me know so we can start to assess that, okay? Before we get started, I'm just gonna ask you a few questions. Do you know where you are right now?
Go to University Hospital.
University Hospital, and do you know what day of the week it is?
It is Saturday.
Saturday, and do you know who the current president of the United States is? Donald Trump. Okay, you are alert and orientated times 4. You are also awake. There's no abnormalities in your speech and there are no involuntary movements. Are you comfortable sitting there?
Yes.
Okay, you look safe sitting there and your posture seems to be looking good. And now we're gonna get started with your head to assessment. So I'm gonna go ahead, I'm gonna go to the side of your head now. I'm gonna check the top of your head, the top of it. No signs of hair loss or alopecia. Your skin looks intact. I'm gonna check the back of your head now. Your skin also seems to be intact. No signs of pressure ulcers. Go ahead and check your coccyx. There are no pressure ulcers. Your skin is also going to be intact there. I'm going to go ahead and check your ears now, okay? Do you wear hearing aids?
No.
No? Okay, I'm going to check the back of your ear. The back of your ear seems to be intact. Let me check inside. No signs of cerumen. Okay, I'm going to go ahead and check the other side now, okay? Back of this ear is also intact. Let me check inside as well. There are no signs of cerumen in that ear as well. And you said you don't wear hearing aids, correct?
Oh, yeah.
Correct? Okay. All right, I'm going to go ahead and check your temporal pulse now. Okay, your temporal pulses are equal, bilateral, 2+ and regular. While I'm here, I'm also just going to check your temperature, okay? Okay, your temperature feels within range. I saw that on your vitals, it said 98.9, and that's pretty much within the range that we're looking for, okay? Now I'm gonna go ahead and test your eyes. Do you wear glasses or contacts?
No glasses.
No glasses, no contacts? Okay, so first I'm gonna check your 6 cardinal filter gates, okay? So I'm gonna have you follow this pen with your eyes and just do no movement, all right?
No alopecia present. Hair is short. I'm just gonna check your right ears or turn to your left. Just here, just on my right.
Okay, looking good. Now I'm gonna go ahead and check your pupils, okay? So I'm gonna shine a light into each of your eyes at a time, all right? So I'm gonna check this eye now.
No existing present.
Okay, now I'm gonna go ahead and note the size of your pupils, okay? Your pupils are right about 3 millimeters and they're also equal, round, reactive to light, and accommodating, okay? So now I'm gonna go ahead and check your nose. Your nose seems to be intact. I'm gonna go ahead and check inside, all right? There is no signs of excess mucus, no signs of polyps. Let me check the other nostril. No signs of excess mucus, no signs of polyps in there as well. I'm gonna go ahead and check your mouth now, okay? Go ahead and open up your mouth. Okay, your oral mucosa seems pink and moist. Can you stick out your tongue for me? Your tongue seems pink and moist as well. There's no signs of thrush, and your tongue is symmetrical as well. Do you have any issues swallowing?
No issues.
No issues swallowing? Okay, well, I'm gonna go ahead and check your neck now, okay? And I also noticed that your teeth are intact. Do you wear dentures?
No dentures.
No dentures, your teeth are intact. Do you have any loose or missing teeth?
No.
Okay, so now I'm gonna go ahead and move down to your neck, okay? I'm gonna go ahead and check your carotid pulse now.
Okay, no nystagmus.
Your carotid pulse is good on that side. I'm gonna check the other side.
I'm gonna shine a light.
Okay, your carotid pulse are, both of them are gonna be equal, bilateral, 2+ and regular, and you said you have no issue swallowing, correct?
No.
Okay, I'm gonna go ahead and test that now. I'm gonna go ahead and put my hands right here. Can you go ahead and swallow for me? Okay, no signs of tracheal deviation. I'm gonna go ahead and check for turgor, okay? I'm gonna go ahead and pinch right here.
About 3 millimeters.
Okay, no signs of tenting, no signs of dehydration. And have you had any recent coughs or any issues coughing recently? No. Okay, no signs of excessive sputum? No? Okay. Now I'm gonna go ahead and test your arms, okay? Give me 1 second, just make sure everything looks right. Okay, I'm gonna go ahead and test your arms. I'm gonna run my hands on both of your arms now. Do you feel that equally on both sides? Okay, you feel equal sensation on both your arms on both sides, okay? Now I'm gonna check your brachial pulse, okay? Your brachial pulse is equal bilateral 2 plus and regular. I'm gonna go ahead and check your radial pulse now. Your radial pulse is also equal bilateral 2 plus and regular. Now I'm gonna go ahead and check your capillary refill, okay? Just stick out your hands for me. You can actually flip up your hands to the side for me.
You're gonna go ahead and check your splitter first. Your splitter's white, no sign of jaundice. You're gonna go ahead and check your
Okay, and your capillary refill is less than 3 seconds on all 10 of your digits. Now I'm gonna go ahead and, do you mind just showing me your elbows real quick? No signs of skin breakdown on your elbows. Can you stick out your arms now? Bring them up, back down. Okay, you have full range of motion on your upper extremities. Now I'm gonna go ahead and test the strength, okay? Go ahead and push against my hands. Okay, now pull back against my hands and squeeze. Okay, you have a 5 out of 5 on strength on your upper extremities. Also looking at your overall skin, there's no signs of jaundice or diaphoresis. Your skin color seems to be appropriate with your ethnicity. Okay, so now I'm gonna go ahead and I'm gonna check your chest, okay? So I'm gonna go ahead and move to your side. Your chest seems to be symmetrical, no signs of accessory muscles or no signs of accessory muscle usage or excessive breathing. There's also no signs of a concave chest. Okay, so I'm gonna go ahead and auscultate your chest now and listen to some lung sounds. I'm gonna listen to 6 spots on the first side. So I'm going to instruct you to take a full breath in and out every time I move my stethoscope, okay? Breathe in. Out. In. Out.
So S1 and S2 are
In. Out. In.
Alright, so
Out. In.
And I saw that your
Out.
teeth is
Out. Okay, your lungs are clear to auscultate bilaterally on your anterior side. I'm gonna go ahead and check your posterior side now. Okay, it's gonna be 8 spots. And if you happen to get dizzy from all the breathing, please feel free to let me know, okay?
prior pulse is
I'm going to take a deep breath
In.
bilateral, 2 plus
Out.
and regular. We're gonna go ahead and check, if you have any problem swallowing.
In.
You just go
Out.
ahead and check your trachea, if you can swallow.
In.
Good.
No
Out.
sign of tracheal deviation.
In.
You're gonna go ahead and check for any skin triggers.
Out.
I'm just gonna go
In.
ahead and pinch your skin a little bit.
Out. In.
No sign of tenting,
Out.
means skin is not dehydrated.
In.
You're gonna go ahead and
And out. Okay.
bring
Your lungs are also clear to auscultate bilaterally on your posterior side as well. While I was listening, there were no signs of adventitious sounds at all. So now I'm gonna go ahead and check for some hard sounds, okay? So I'm gonna be listening to 5 spots. Feel free to breathe as regular as you'd like.
Check your pulse, your equal bilateral, 2 plus and regular. You're gonna go ahead and check your radial pulse right now.
For 1 full minute, okay?
Radial pulse is equal bilateral 2 plus. You're gonna go ahead and check the capillary resources and bring your hand up.
Okay, your S1 and S2 are present. Now I'm gonna go ahead and assess your pulse. I'm gonna be doing that at your apical pulse. This is in between the 4th and 5th intercostal space at your left midclavicular line, okay? I'm gonna be there for a minute. Don't worry, nothing is wrong. I just wanna make sure I get an accurate assessment of your heart rate, okay?
Score is 5 out of 5. Right here, just have you check your no sign of skin breakdown, but you have to
I'm going to
just
be your student nurse today. Can you please take a look at your wristband and please tell me your first and last name?
upper extremities have full range of motions. And now I'm gonna go ahead and check your diet. Before we get started, do you have any further comments?
No allergies.
Any excessive sweetness? Okay, so listening to your lungs, I'm just gonna check the side.
So for the purposes of the video, every 30 seconds.
No excessive breathing and no sign of
So your heart rate
chest.
was,
You're gonna go ahead
Right
and
here, but
and
check
your
your breathing if I can
final
have
respirations as well, that was 16.
so it's really in pain. What would you say that the pain
I'm gonna go
on a
to
scale of 0 to 10? 0
the
pain,
backside here.
0 pain, no pain at all, and 10
Go
being
into your
says clear to auscultate on the anterior side.
Take a deep breath in.
Check the posterior side.
Moving it
Out.
around. Okay. Sounds good.
In.
In.
I'm going to do a
Out.
physical assessment on
In.
you just to
Out.
make sure
In.
no breakdown and everything like that. Is that okay? That's fine. Okay.
Out.
In.
I'm going to raise the blood up.
In.
Out.
Out.
In.
Out.
Okay, after 60 seconds, I measured your heart rate to be 80 with a sinus rhythm, and I stayed there an extra 30 seconds to get your respiratory rate as well, and I got measured that at 14. That seems to be concurrent with your vitals and within range of what we're looking for. I saw in your vitals that your oxygen saturation was 98%. Okay, so now I'm gonna go back up to your eyes, okay? I'm gonna go ahead and check your eyes. Your sclera seems to be white on one side, sclera seems to be white on the other side. I'm just gonna go ahead and pull down your eye, okay? I'm checking your conjunctiva. Your conjunctiva seems to be pink and moist, so I'm gonna go ahead and check the other side. Your conjunctiva also seems to be pink and moist on the other side. No signs of abnormalities or jaundice. Okay, now I just have a few funny questions I'm gonna wanna ask you, okay? First, we're gonna start with your diet. So what do you usually eat on a daily basis, or what does your diet consist of?
Protein, rice, and veggies.
Okay, that sounds pretty balanced. That seems to be exactly what we're looking for. How about your water intake? How much water do you usually tend to drink?
2 cups.
2 cups, okay. We'll see what we can do to try and increase that. Do you enjoy the taste of water? Do you not like it?
Not really.
Not really? Okay, well, we'll see what we can do. Some friends of mine, they like to add like meal or crystallite in their water, make it more flavorful. We just really want to make sure that you're hydrated, okay? Now, time, I just have a few funny questions. When was the last time you pooped?
Yesterday.
Yesterday? Okay, and how often do you usually poop?
Twice a day.
Twice a day? Okay. And what is the normal consistency of your poop, or what was it like the last time you checked?
Brown and soft.
Brown and soft? Okay, that's exactly what we're looking for. And how about your urine output? How frequently do you urinate?
4 times a day.
4 times a day? Okay, do you have any issues getting to the bathroom?
No.
No? Okay, do you have any difficulty urinating, or does it hurt at all?
No.
No? Any abnormal odors?
No.
No? Okay, and do you have to go right now?
No.
No? Okay, so now we're gonna go ahead and get started with your abdominal assessment, okay? So I'm gonna go and have you lay down on this bed if that's okay. Feel free to rest up your legs. And if you don't mind, if you just lift up your gown just so I can inspect your abdomen.
Can you please just follow my lead?
Okay, perfect. Do you mind lifting up just a little bit more? Thank you. Okay, so upon inspection of your abdomen, I do not see any abnormalities. I don't see any lesions, don't see any bulges. I don't see any enlarged organs. So I'm gonna go ahead. First, I'm just gonna auscultate your bowel in your abdomen. I'm gonna start in your right lower quadrant. Actually, I'm gonna move on to this other side. Give me 1 second. Move on to this other side. I'm gonna start with your right lower quadrant. I'm gonna move in a clockwise order, okay? Start in your right lower quadrant.
Now I'm gonna go ahead and check your diaphragm.
Your right upper quadrant.
I have a few questions to ask.
Your left upper quadrant.
How is your diet like, and what do you usually get in a day?
And your left lower quadrant.
Sounds good. Sound like you're doing a good job.
Okay, your bowel cells are present. Now I'm gonna go ahead and palpate your abdomen, okay? I'm gonna be going in that same clockwise order. First, we're gonna start in the right lower quadrant. I'm gonna go about 1 to 2 centimeters, okay? In your right upper quadrant, your left upper quadrant, and your left lower quadrant. Okay, upon palpation, I did not notice any signs of tenderness, no signs of enlarged organs. Now I'm gonna go ahead and do a deeper palpation, okay? You might feel this a bit more. This is gonna be about 4 centimeters, all right? In your right lower quadrant, it's going in the same order. Right upper quadrant,
Do you have any questions for me?
left upper quadrant, and your left lower quadrant. Okay, and upon a deeper palpation, just like with the lighter palpation, there's no signs of enlarged organs. There's also no signs of tenderness. I'm also just going to palpate your bladder real quickly, okay? Your bladder does not seem to be distended, and there's also no signs of hardening in your bladder. Okay, well that concludes pretty much your abdomen assessment. We are almost done. We're just going to test your lower extremities now, okay? I'm going to have you sit up again if you just meet me back again on this side. Okay, so first we're just going to start off with assessing the strength of your lower extremities, okay? I'm going to go ahead and put my hands here if you just push up with your thighs. Perfect. Okay, now can you push up with your legs?
Okay.
Amazing. Now can you pull back?
Same thing on the back, okay?
Great. Now I'm going to go ahead and check your popliteal pulse while I'm here, okay? Okay, your popliteal pulse is equal bilateral 2+ and regular. I'm going to go ahead and check your posterior tibial pulse now, okay? Your posterior tibial pulse is also going to be equal bilateral 2+ and regular. I'm going to be checking for pitting edema now while I'm here as well, okay?
Good. No sign of tension over.
Okay, no signs of pitting edema. That's going to be a 0 on the pitting edema scale. I'm going to go ahead and check your dorsalis pedis pulse now, okay?
And one more deep breath.
Less than 2 seconds.
Okay.
Okay, your dorsalis pedis pulse is also going to be equal, bilateral, 2+, and regular. Now I'm going to go ahead and test the strength of your feet. Okay, so go ahead and push up against my feet. Amazing. Now go ahead and push down like a gas pedal. Perfect. You have your strength on your lower extremities is going to be a 5 out of 5. I'm going to go ahead and test the capillary refill of your lower extremities. Okay.
I'm going to check your arms real quick. Do you feel this? I do.
Strength is
I'm going to feel your auricular wall. You can just relax.
Okay, the capillary refill on all 10 of your lower digits is going to be less than 3 seconds. And that pretty much concludes the examination of your lower extremities. I'm going to test your gait and range of motion in just a second. First, just let me go ahead and change my clothes, okay? One second. While I do this, do you have any fun plans for the weekend? Anything you have coming up that you're excited for?
Nothing, just studying.
Just studying? How's that going for you? What are you studying?
Feel good. Studying nutrition.
Nutrition? Is there anything exciting that you're learning about or anything that you're incorporating into your current diet?
No.
No? Okay. Well, I remember when I took that class, I really liked learning about the protein source. That's something I like to implement. So it seems like you already have a pretty balanced diet, but if you'd like to incorporate more, I'm sure you'll probably learn a lot more in that class, okay? I just remembered, I just want to check the capillary refill on your upper extremity, if that's okay? Do it one more time on this side.
Any discomfort? Any abnormal odor? No. Okay, do you have pain? How much water do you typically drink?
Okay, the capillary refill is less than 3 seconds on all 10 of your digits of your upper extremities. I also want to note that there is no signs of cyanosis, and there is no signs of a lowered temperature on your digits, okay? And now we're just going to go ahead and test your gait and range of motion, okay? I'm going to go ahead and help you up. Now, if you could just go ahead and walk to this curtain and back for me. Okay, your gait seems to be steady and smooth, maybe just a little bit of slight guarding in that ankle, like you said. And now we're just gonna do some range of motion exercises, okay? You just hold on, you just hold to the side of the bed for support. You go there, just follow what I do. Right leg up, right leg back, left leg up, left leg back. Okay, you have full range of motion in your lower extremities, and that concludes our head to toe assessment. Do you have any questions?
No questions.
No questions? Okay, and I saw that the doctor prescribed 400 milligrams of ibuprofen for you to take, and I think you're gonna follow up with us in about 2 weeks. If you have any questions, feel free to let us know, but you are free to go. Have a good rest of your day.